importance, relevance of the microbiota, the microorganisms in our GI tract in oncology. The final summary is that the microbiota is very relevant, participates or originates cancer. I explained three cancers: breast, lung, and GI tract. In all of these three cases, by consensus, we have a model of the mechanism of action by which a dysbiosis, a major concept, dysbiosis is a perturbation, is the aberration of the normal gastrointestinal flora, the microorganisms. And they contribute by inflammation of the mucosa, by penetration of the epithelial cells of the lung, of the breast, or of the GI tract, leading to genomic instability, mutations, and chronic inflammation. We all know that cancer grows with chronic inflammation. Chronic inflammation, chronic hepatitis, hepatoma, H. pylori, GI, stomach cancer, smoking, lung cancer, so inflammation. So microbiota alteration contributes to cancer. And also very important that has been, I talk in my last slides, is that you have a good microbiota, in other words, a good GI tract organisms, you respond better to chemotherapy, and most importantly now in immunotherapy. In melanoma, where we have now the great monoclonal antibodies, the so-called immunotherapy, we know now that people with good microbiota, so in other words, the GI tract microorganisms are okay, in equilibrium, they respond much better than people who have abnormal microbiota. They have better progression-free survival than people who have better microbiota. And something that my colleagues, they don't know or they ignore is that after chemotherapy, you destroy the bacteria more than the cancer cells. And we do nothing. So after the chemotherapy, we should restitute by probiotics, by prebiotics, etc., by diet, those microorganisms that we have destroyed with the bacteria, because our patients will have much better responses. So we have microbiota causes initiation of cancer, progression of cancer, and also we have better responses to the chemotherapy and immunotherapy. In breast cancer, I put just a nice slide where we know that the estrogens produced by ovaries, etc., they go to the circulation, they pass through the liver, and through the liver are conjugated, and they're removed by the body, by the kidney, or by the GI tract, okay? Now, there are people in the so-called stroboloma with the genes from bacteria in our GI tract that, if they are very active, they convert the estrogens, and those estrogens, instead of being removed by the body through the feces, go back to the circulation. So then we have many more estrogens in our body. And those people, thanks, or no thanks, by the GI tract, they eliminate less estrogens. So they have more estrogens in our body, in the circulation. Women, those people have higher risk of breast cancer because the body, there's no thanks, due to the bacteria in our GI tract, they recover more estrogens in the circulation, putting at risk of breast cancer those women. And in the lung is that there's a connection, lung, GI, and from the GI can go to the lung. We thought that the lung was a sterile organ, no microorganisms. Now we know that the lung has particular microorganisms. The dysbiosis in the lung can cause lung cancer together with all the toxins and bacteria from the GI, from the microbiota. Obviously, people will say to me, if you smoke or you don't smoke, obviously you smoke, you have more chance of lung cancer. But you do not smoke and you don't take care of the biota, you have more chances of lung cancer than people who have a normal probiotica. So the moral of the story is that we have to take care of our GI tract by having prebiotics, probiotics, and having a very good equilibrated flora. I said, for instance, we have wheat with the gluten. This causes inflammation. Anything that causes inflammation in the GI tract is bad for the whole body. So we have to prevent inflammation, no gluten, no transgenics, processed foods are terrible for the body. Meat, if it's from the from the high mountains and good, but if the animals they eat pesticides, antibiotics, and hormones are not good for our body, and no processed food. So we know this, but we don't follow this. Okay, so we have to take care of our GI biota to have a good life.